everyone, this is Suprava. Welcome back to another session with me. In today's session, we will be discussing about acute renal failure. Now, from the name itself, you can understand that this is related to kidney, right? Yes. And if we see the term that is acute renal failure, the term is very simple, right? We can understand that that means kidney failure, or we can also say acute kidney failure. Now, by the term kidney failure, what we are trying to say. So, kidney failure means definitely the kidney is not able to function properly, right? There is deterioration of the renal function. How the kidneys are supposed to function? It is not functioning like that. Now, if it is not functioning like that, then what would happen? So, definitely there would be reduction in urine excretion. So, if there is reduction of urine excretion, we can see oliguria or we can see anuria. That means there would be less urine output or there would be no urine output at all. And if there is no urine output or there is less urine output, what is going to happen? That the kidney, it excretes the waste, right? So if there is no urine production, then what is going to happen? These metabolic waste are going to build up in the blood. So there will be accumulation of these waste products, and also there would be imbalance of fluid and electrolyte. Well, so this is what we understand when we see the term acute renal failure. So in general, we understand, this about renal failure. Now, let us move to the definition of acute renal failure to understand it in a more better way. So the definition says that acute renal failure is a clinical syndrome in which a sudden deterioration in renal function results in the inability of the kidneys to maintain fluid and electrolyte homeostasis. So again, it is a clinical syndrome in which what is happening, there is deterioration of the renal function. So the kidneys are not able to function properly, and then due to that, whatever the functions of kidneys are there, that is not going to happen, right? So there would be fluid and electrolyte imbalance. Now let us move to the etiology. So the etiology of acute renal failure can be divided in three causes, right? So we have three causes here, that is pre-renal cause, intrarenal cause and post-renal cause. So first let us talk about pre-renal cause. Now first we have to understand what do we mean by this term that is pre-renal, right? So what is this term is pre-renal cause? So basically pre-renal cause is something in which the problem is occurring in the circulatory system before it is reached the kidney. So these conditions are related to the problems occur in blood supply to the kidney. And this can be either due to systemic hypovolemia or renal hypoperfusion. So let us see what are the pre-renal causes that can cause acute renal failure in children. So the first thing is hypovolemia related to diarrheal dehydration. So if there is dehydration due to diarrhea, in that case there can be hypovolemia that can again cause acute renal failure. And then if there is shock, burns or diabetic acidosis, and then trauma, hemorrhage or congestive cardiac failure, etc. So these things are considered as pre-renal cause, and this can cause hypovolemia, and due to that again there might be acute renal failure in children. Now next is intrarenal causes. So intrarenal means when there is direct damage to the kidneys, and because of that there is loss of kidney function. So basically this intrarenal causes can reduce the GFR, can cause renal ischemia and also tubular damage. So if there is glomerulonephritis or hemolytic uremic syndrome, renal vein thrombosis and acute tubular necrosis, these things can cause direct damage to the kidneys. So these are considered as intrarenal causes. Next is post-renal causes. So post-renal causes is something when the problem occurs below the kidney. Might be any obstruction in the urinary tract, because of which there would be building up of waste product in the kidney. So the causes can be if there is renal calculi or if there is bladder neck obstruction, and in case of congenital lesion and pus collection in the urinary tract. So these are considered as post-renal causes. So these also might cause acute renal failure in children. Now moving on to the phases of acute renal failure. So majorly we have 4 phases of acute renal failure in children. So the first phase is initiating phase. Now this phase lasts from hours to days, and this results, this manifests as a renal function impairment. Now the second one is oliguric phase. So oliguric phase lasts from 5 to 15 days, but it can be prolonged for weeks. In infants and children, this phase is shorter, whereas in older children, it is quite longer. And if this phase lasts for more than 3 weeks, it indicates that there is irreversible renal damage. And then the third one is diuretic phase. This phase lasts for few days, and we can see mild to severe clinical features particularly in this phase. And then at last, the fourth one is recovery phase. So in this we can see resumption, the final resumption of normal urine output, and also the biochemical alterations in the blood. Next, moving on to the symptoms of acute renal failure. So the first thing that is very common, which is decreased urine output. And then we can see edema, especially in the lower extremities. We can also see certain psychological changes, because as there will be, the waste products would build up in the blood that can reach the brain, and it can affect the mental status of the child. So we can see some psychological changes also. Then there can be heart failure, there can be nausea, vomiting. And apart from these things, there can be also pruritus, anemia, and the child will be tachypnic, and they will have cool, pale, moist skin. Now moving on to the diagnostic measures. So in diagnostic measures, the first thing that can tell us about impaired renal function is blood test. So in blood test, what we can say is there would be raised serum creatinine levels. And then we can also do urine examination. So in urine examination, we can see proteinuria, hematuria, or presence of casts. Then we can also do ultrasonography. So through ultrasonography, we can find out if there is any structural abnormalities because of which there is impaired renal function, and if there is any renal calculi or presence of any renal calculi. And then abdominal X-ray can be performed, and also kidney biopsy can be performed. Now moving on to the management of acute renal failure. So the management should be based on the underlying causes, and we have to correct the dehydration, we have to correct if there is shock or if there is hyperkalemia, we have to correct these things. So first we would focus on fluid and electrolyte balance. So for that you have to calculate the fluid requirement properly. The child should not get too much of fluid, because already there is, the kidney is not functioning properly and there is no urine output, there is less urine output. So we have to, calculate what is the fluid requirement for the child, that we should calculate properly, and then only we should provide the fluid. And then coming to the diet, so there would be diet restriction. So while planning for the diet, you have to make sure that it is low in sodium, low in potassium, and also it should have low phosphate, and there should be moderate protein. So these are the things that you should keep in mind while preparing the diet for the child. And then diuretics can be used like mannitol or furosemide. So diuretics will help in removing this excessive fluid which has been built up in the body. And in case of life-threatening complications, we have to start with the dialysis. So in that case, we have two types of dialysis, that is the peritoneal and the hemodialysis. So whether we should go for dialysis or not, that depends on certain criteria. Now, if our serum potassium level is more than 7 milliequivalent per liter, and persistent, in that case it is an indication for dialysis. And then if there is congestive cardiac failure, pulmonary edema, if there is severe acidosis, and if there is neurological problems due to uremia and hyponatremia and hyperphosphatemia. So these are the things that will indicate that whether we should go for dialysis or not. Next, moving on to the nursing diagnosis. So what are the nursing diagnoses that will be there for acute renal failure? So the first thing will be risk of fluid electrolyte imbalance related to the impaired renal function. And then there would be also risk of infection related to alteration of host defense. Activity intolerance will be there, and then again the child can have altered thought process. There would be altered nutrition, fear and anxiety, and also knowledge deficit. Well, so these are the problems that would be there when we are taking care of a child with acute renal failure. So as a nurse, what are the interventions that we should take up, while taking care of a child with acute renal failure? So first thing is that we have to maintain the fluid and electrolyte balance, and for that we have to continuously monitor their intake and output chart, and we also have to monitor their serum electrolytes, and we have to monitor if there are any features of heart failure. And then you have to administer the medications as it is prescribed, and then while providing diet, you have to make sure that you provide the diet which is low in sodium, low in potassium, and it is high in carbohydrates. You also have to make sure that you have to provide small and frequent feeding. And then you have to provide adequate rest to the child. Also, you have to prevent infection in these children. So you have to use all the aseptic techniques, and you have to make sure that the parents understand how important it is to follow all the hygienic measures. So you have to continuously monitor the child for any signs of infection, and if you find out any early signs of infection, you have to treat that at earliest. Then the child also might experience convulsions at times if it is very severe. So in that case, you have to prevent injury during the convulsions. You have to make sure that the child is in safe area. And then you also should provide care for dialysis. Apart from these things, you have to provide emotional support to the child, to the parents, and to the family members. And along with that, you have to make sure that they understand how to take care of the child at home after discharge. Well, that was all about acute renal failure, which means that the kidneys are not able to function properly, and due to that there would be fluid and electrolyte imbalance, and that would cause many other problems, right? So let us conclude our today's topic here. I hope you have understood the topic. Thank you.